Today topic is lumbar puncture. Lumbar puncture also known as spinal tap. So it will be done for diagnostic and therapeutic purpose. So diagnostic in the sense to know the some disease condition or to induce a medication. This procedure will be conducted by the doctor. Lumbar puncture is the insertion of specialized needle into the lumbar subarachnoid space to gain access to the cerebrospinal fluid. So, the needle will be inserted into the subarachnoid space to aspirate the spinal fluid. What are all the indications for lumbar puncture? So, lumbar puncture should be performed for the following indications: to diagnose meningitis and to diagnose SAH, subarachnoid hemorrhage, suspicion of central nervous disease such as GB syndrome and carcinomatous meningitis, and also this lumbar puncture will be done for a therapeutic relief of pseudotumor cerebri. So, these are all the main indications for lumbar puncture. How to perform this lumbar puncture in the sense? Local anesthesia should be given before the procedure. The patient is placed in a lateral recumbent position with the hips, knee and chin flexed towards the chest. So, he has to open the interlaminar space or interspinous distance. A pillow may be used to support the head. So, this is the position will be preferred for the lumbar puncture. Position of patient. Spinal cord ends at L1, L2. So, sites for puncture are located at L3, L4 or L4, L5. Restrain patient in lateral decubitus position. Maximally flex spine without compromising airway. Keep alignment for feet, knees and hips. Position head to left if right-handed or vice versa. What are all the contraindications for lumbar puncture? So, when there is an increased intracranial pressure should not be done. LP, cerebral herniation, impending herniation, possible increased ICP and focal neuroscience, coagulopathy, prayer lumbar surgery, severe vertebral osteoarthritis or degenerative disc disease, significant cardiorespiratory compromise, infection near the puncture site and space occupancy lesion. What are all the complications from lumbar puncture? So, patient may feel headache, back pain, bleeding or fluid leak around spinal cord, infection, pain, hematoma, subarachnoid epidermal cyst, ocular muscle palsy, nerve trauma, brainstem herniation. So, these are all the complications we may expect from lumbar puncture. So, let us see the procedure how to perform lumbar puncture.
Yes, yes, yes. So, so here we are doing lumbar puncture. So first I'll begin with sterilization of the area by applying betadine lotion. Cleaning it with spirit. Dry gauze. uh, marking of the site of puncture. So ideally, lumbar puncture is done at the level of L2, L3, L3, L4 space, intervertebral space, as the spinal cord ends at the level of L1, L2. So the ideal position will be the intervertebral space between L2, L3 or L3, L4. That we can grossly mark by first locating the posterior superior iliac spine of both hip bones. Here we can look at coming to the medial point. Here is the ideal site. So we have to uh, feel the uh, posterior process of the spine and mark the depression between the spinous process of the vertebra. So that is the ideal space. So here I'll give the local anesthesia. Collecting the required amount of CSF fluid for analysis. So we have to take out the needle and close the site with a betadine gauze. Gentle removal of the spinal needle and should apply a pressure dressing over there.